Health officials in Florida are now sounding the alarm because more than 40,000 people who got that first dose of the vaccine are overdue for their second dose, so they haven't come back for it. Some health experts say seniors are avoiding the second shot because of rumors that the side effects are more severe. And to help us understand exactly what's going on here, to address some of the concerns, we're joined by Dr. Preeti Malani, Chief Health Officer at the University of Michigan and also an infectious disease expert. Dr. Malani, thank you so much for your time tonight. I think let's start there with the concerns that people may be having over this second dose of the vaccine. What is your message to folks tonight about the safety of that dose?
Yeah, so this is a good question, and I have to say I'm due for my second dose pretty soon, and I too am concerned, but I'll be going there for sure to get my second dose. It's really important to get that second dose to get the full benefit of either of the vaccines. And the side effects that people have vary a lot, and they tend to be short-lived and pretty mild, although they may be a little inconvenient. This is just a short amount of time.
What can you tell us about the efficacy of the first dose and the second dose? For people who have received just one dose, how much are they protected? And then the second dose, how does that boost protection?
So that's a great question. And the best that we can understand the two doses together, that's what really gets us to that 95% effectiveness. And with only one dose, it's probably only like 50% effective. So it's a big difference. And although one dose would provide some protection, that's not what was studied in the trials. And so really, I want to encourage everyone to go and get that second dose.
What can you tell people about the side effects that they should expect that are normal side effects when you go to get a vaccine of any form?
So the kind of things that people have been having are, sore arm, flu-like symptoms. Sometimes people have a little bit of a fever, chills. They just don't feel great. They don't feel like themselves. And what I've seen among my colleagues who've gotten their second dose, who've had a little bit of a hard time with it, is that they're kind of back to normal within a day or two.
Can those side effects be more severe for people who are at risk, for instance, of allergies, or are elderly who we're seeing, at least in the case in Florida, who are hesitant?
Yeah, so it's hard to predict exactly who's going to have the side effects. And in fact, what people are asking about now is, hey, I didn't have any side effects. Are you sure I responded to the vaccine? And trying to reassure people that, yes, you did respond to the vaccine, and people's bodies are a little bit different. As far as we know, there's not really a specific age association. It's kind of person to person, and we're getting more experience with it now. But again, what I've seen is really mild to no symptoms with the first one, and with the second one, maybe a few hours of symptoms, maybe a day at most.
But your advice is to get it. So I'm curious how concerned you are about this new variant that we continue to hear more about that is more contagious.
Yeah, so the B.1.1.7 variant is something that we are seeing. In fact, over the weekend in Washtenaw County, where I live, it was described, and there was a press release put out. We're concerned not because it causes disease that's different, but as you said, it's more contagious. And right now, we're kind of up against the clock. If we end up with this variant spreading and lots of cases, and we're not at the point where people are vaccinated, we could have another big surge, and it could lead to obviously a big bump in hospitalizations and, of course, bad outcomes.
I would like to get your thoughts on distribution at this point. I mean, to put it bluntly, it has been just a mess, frankly, all across the country. Some states saying it's been worse than others to get the shot in people's arms. Looking at the numbers, 31 million doses distributed, 1.6 million people have received both doses. We have a long, long way to go. What is the fix? What's the easy solution moving forward to make sure that people are vaccinated more quickly?
I think what I would say is that doing mass vaccination is hard, and states have been doing this on top of everything else that they've been doing, and this has been a really difficult year. Places are stretched. A lot of states don't have a lot of resources or people to do this. So, my hope is that there's going to be a big bolus of money and resources, as well as vaccine, that's going to arrive in the coming days and weeks. And what's nice is I do think a lot of places have systems that are up in place. I know for us at the University of Michigan, the capacity we have is maybe up to 28,000, 30,000 doses a week. Right now, our limitation is vaccine, not actually man and woman power to deliver the vaccine. So it has been bumpy, and the supplies haven't been consistent, but my hope is with the emphasis with the new administration on this and continuing the work that's been done, is that things are going to get better, but everyone needs to really be patient.
All right, and optimistic, and I appreciate that from you tonight. Dr. Malani, thank you again for your time.
Thank you.